Good afternoon. Today I wanted to address a few specific examples of just how healthcare reform will positively affect people in our 21st Congressional District. Last August, at one of my healthcare forums, this in Delmar, we heard from a constituent named William. William's wife, Elena, was on bed rest and unable to attend, but William came to speak on behalf of his wife. He told us about how she was diagnosed with cancer at the age of 10 and has had several recurrences of cancer and undergone several surgeries since. Elena found it impossible to find a doctor that would accept her because of her complicated medical history. Only through marriage was she able to gain coverage, and even then she was denied care. Under our healthcare reform law, those in Elena's situation will no longer be denied coverage. The uninsured will have immediate access to insurance despite their pre-existing conditions through a temporary high-risk pool that is put in place until a larger bit of reform is impacting in 2014. For those with insurance, the law also provides free preventative care to catch medical problems early so that they are easier to treat. Last August, we also heard from Karen. Karen is a diabetic who was out of work, had been out of work for a while. Her husband is a painter whose company doesn't provide health care insurance. When Karen first lost her job and her health insurance, they tried to rely on COBRA, but it proved to be very costly, and they had to cancel it. They went months without medicine or seeing a doctor until they landed in the emergency room. Karen with a blood infection and her husband with chronic obstructive pulmonary disease. They still struggle to pay for the very expensive prescription drugs her husband needs to treat his COPD, and they constantly worry about dealing with the next healthcare crisis. Under the new law, if you purchase insurance through an exchange, your insurance is no longer tied to your employer. It becomes portable. Karen will be able to purchase affordable insurance and maintain her coverage. In addition, Karen and her husband will both have free preventative screenings in the future, hopefully eliminating the need for emergency room visits. They will also be eligible for coverage in the high-risk pool starting immediately. Healthcare reform is real, with real benefits for real people with real hardships in our communities. It will return control over healthcare decisions to you and your doctor, not a large insurance company interested in making those record profits. Thank you for listening.